Treatment of hyperthyroidism. Um, okay, 5 sensible points about treatment of hyperthyroidism. Beta blockers. The first one is beta blockers. Second, anti-thyroid medications. Third, radioactive iodine. Fourth, thyroidectomy. Five, eye and skin lesions. Treatment. Okay, so beta blockers which we are using is propranolol. Anti-thyroid drug which we are using is carbimazole and propylthiouracil. Carbimazole is used when the person is not pregnant. Propylthiouracil is used in pregnancy. Radioiodine is I-131 and thyroidectomy can also be done. Eye and skin lesions are going to be treated with steroid. Eye lesions can also be treated with radiotherapy. Moving on to the clinical features of hyperthyroidism. So just 10 points about it. Okay, so treatment of hyperthyroidism, 5 points we saw: beta blockers, anti-thyroid, radioactive iodine, thyroidectomy, and steroids. Moving on to the clinical features, 10 points we will see. First one is increase in the size of the thyroid gland, so which is called goiter. Second is GI problem. Third is cardiopulmonary. Fourth is neuromuscular. Five, dermatological. Six, reproductive. Okay, just remember six and sex. So six is reproductive function. And seven is ocular. Eight is heat intolerance. Nine is calcium. 10 is lymph nodes. So let's see one by one. Goiter is nothing but enlargement of the thyroid gland. So that is seen in case of hyperthyroidism. GI dealer, there will be diarrhea. This because just remember, thyroid is a hormone which is going to increase everything. Okay, it increases the motility of the GIT as well, so it causes diarrhea. And because the person is having diarrhea, the person's stomach is not going to have adequate amount of food in stay for like absorption, so there will be weight loss in spite of increased appetite, because the person can't keep quiet, so they keep eating a lot, but then the GIT keeps excreting it a lot, so there will be uh, weight loss associated with it. And then glycosuria will also be there, and then in the gastrointestinal tract also the glucose is getting excreted. The third one is the cardiorespiratory. There is palpitations, afibrillation, and means Lerman scratchy sound which is produced from the precordium. It's called means Lermand sound. It's a scratchy sound which is heard on top of the chest. Okay. Yeah, moving on to the fourth one, which is neuromuscular. Neurological, there is emotional lability. The person is very emotionally labile. So there is anxiety and all. And apart from that, muscular, there is hypokalemic periodic paralysis because all the potassium is going to get used up, which is why. And then dermatological problems is thyroid acropathy, which means the finger clubbing will be there. And apart from that, peridubial myxedema will also be there. Reproductive functions, there is a reduced period, reduced libido, and then there will be gynecomastia as well. Ocular problems include a lot of different signs are seen: Stelzach sign, Geoffroy sign, Mobius sign, Von Graffi sign, and Dell-Lim sign. Stelzach sign is nothing but they stare at the person. Geoffroy is like, remember Jeffrey. Jeffrey is Jeffrey. Okay, Jeffrey doesn't think, so loss of wrinkles on the forehead is going to be Jeffrey sign. Mobius sign, just remember no bias. So the person will not be agreeing, so will not have any convergence. Weakness of convergence is Mobius sign. Joffrey sign is lack of wrinkles. Mobius sign is weakness of convergence. And the first one which we saw is this Stelzach sign, which is they just keep staring. There is no blinking. Reduced blinking is Stelzach sign. And two more signs are also there in case of hyperthyroidism, like Von Graffi sign and Derilim sign. In Von Graffi sign, there is a lid lag with down gaze. Von Graffi sign is lid lag with down gaze. So graph sounds like grass, right? So they keep staring at the grass. So there is a down gaze and the lid lag. So like when the person is opening the eye, the lids will be lagging. Dairy limb sign, L and R are there, so LR is a problem. That is, LR stands for lid retraction. Upper lid retraction is Dar limb sign. So it's Dal Drimpli, Dal, DAL, RYMPLE, Darlimpi sign. And eighth is heat intolerance, ninth is hypercalcemia, 10 is lymphadenopathy. So summary, clinical features: goiter, GI problem, cardiorespiratory problem, neuromuscular problem, dermatological problem, reproductive problems, ocular problem, heat intolerance, hypercalcemia, lymphadenopathy. We also saw treatment of hyperthyroidism. Thank you.